day to day. I mean, I clock in. I mean, for today, for example, I clock in as early as 7 o'clock. I'll take my lunch around like give or take probably 12, 11:30. I'll be out of here by 3, probably 3 p.m., 3:30. But in between all of that, I mean, since I am working in the urology department, it is heavy most of the time. I'm seeing as much as maybe roughly, if people are coming in, maybe between 30 to probably 60 people per day. Since it is procedures, I am assisting for the most part with setting up procedures or doing vital signs or consent forms. And just other little things around the office, whether it being like point of care testing with the urine, taking down specimens to the labs, taking down other scopes and other instruments that we do utilize in the hospital as well too, to where they need to be. And if I need to make calls to patients, I will go ahead and do so as well. Just very dependent on what the day is looking like, but for the most part, that's kind of what it's looking like. And like I said too before, you're always engaging with different types of people, so that's kind of where you have to kind of learn how to code switch as much as be able to adapt and like go back to how you are as a person too. And just be willing to talk to the person regardless of where they're from or how they are as a person, and just kind of go with the swings of whatever's happening in the moment too. Likely, at least here, I'm working currently at UCSF, but it is a lot more on the more educational side, so I'm not too hands-on with the doctors at times. But I will say at other clinics, such as my old job over there at Kaiser's Uro department, is a lot more hands-on. So you're going to be a lot more engaged with different type of procedures, like not just cystoscopies, but also biopsies of the prostate. You have vasectomies. You have hydroseals. You'll have what else? Sometimes you'll walk in with the nurses when they're doing catheter pulls, insertions too. So you're going to see a lot of things, but that's kind of where you kind of have to gauge yourself there too, and tell yourself, are you willing to kind of see all those little things, and be in those rooms for who knows how long. I mean, I was in a room for a procedure for about, I would say as long as maybe 40 to an hour, just with the patient, helping out the doctor with a whole lot of things that are going on with that individual at that point in time. But it's a very rewarding though, and just being there with that person too, and hearing all those little old stories that they have.